The reform proposes a new approach, shifting from reacting to problems to preventing them.
That's Health Minister Sonia Bélanger, tabling a new bill that would make it easier to confine people experiencing a mental health crisis.
After over 25 years without major changes, there was a need to revise Bill P-38.
The current law, P-38, only allows involuntary confinement in extreme cases, where danger is deemed grave and immediate. The new law, Bill 23, would make it easier to forcibly detain someone because it would loosen the criteria, allowing it in situations where someone is considered a danger to themselves or others. The idea is to allow authorities and mental health staff to get involved earlier when someone is unwell. During the announcement, Bélanger talked about the stabbing death of Maureen Brault, a provincial police officer who died in 2023 while trying to arrest a man with schizoaffective disorder.
Someone who needed help, who could have gotten some help before because the authorities were sometimes involved or contacted by the family or the neighbors. That's the kind of situation that the new bill tries to address and prevent. We're going to be able to work before that kind of that kind of situation happens.
This psychiatrist says the bill would bring welcome changes.
Most people who have a mental disorder are not a danger to other people and to themselves. The problem is the illness that is not treated. So the idea is not to lock up people and leave them in the institution or in the hospital without care. The idea is being able to prevent this very severe presentation of mental illness before it gets there.
The bill includes several other changes as well. It would create a special division within Quebec's administrative tribunal dedicated solely to cases like these, where people are involuntarily confined. The bill would also allow people with mental health issues to consent or refuse certain treatments before a crisis happens. But the proposal is already sparking debate over civil liberties and how best to improve mental health care. This human rights advocacy group says that forcing someone to receive care can create distrust in the healthcare system.
A lot of people who went through that said it was the most violent experience that they've been through, and also it cut their link to the health system because it was so violent. It's also most of the time a police interaction that turns out to be very violent. That's not what people need when they have mental health challenges.
Guinette says she would rather see provincial efforts expand access to mental health services, including more staff and more places to get care.